Okay, you just completed the world-renowned pinhole surgical technique with yours truly, Dr. Lowe at Lifetime Dental Care. Let's go through some home care instructions for you to heal optimally. This is your post-op instruction sheet. It was included with your home care kit today to take home with you. It's not highlighted, mine is just for this discussion, but please follow every single one of these things for optimal healing to be accomplished. Number one, no brushing of this site for 4 weeks. That's right. Do not brush the site that we worked on for 4 weeks. And no flossing. You can't floss this area either. Those gums are tender and they need to start healing. Don't touch it. Don't look at it. Don't pull your cheek back. Don't look at it. Don't ask your friend to look at it. Don't get your selfie out and take a picture for your phone. Don't do anything at it. Don't obsess over it. If you do worry about the appearance of those gums over the next 6 weeks and call us, we're going to tell you to refer to number 8 on your sheet, which says do not look at it and do not obsess over it and do not call us about it. We don't want you doing that. Let it heal. It needs to be left alone. Rinse only with your lips apart. That's hard to do, but try salt water, about a teaspoon or a tablespoon of salt and about this much warm water. Stir it around. It'll be kind of cloudy. Rinse for about a minute and rinse like this. Don't get violent. Like, you don't want to rip the site open. You want to keep it nice and calm, but the salt water will help you heal. Do this 3 to 5 times a day. Whatever you want to do is fine on that one. And then the most important thing, no smoking, no chewing tobacco, no vaping, no marijuana, no pipe, no cigar, no tobacco products for extremely obvious reasons. Heat and chemicals will infect your site and kill it and burn it and poison it, so don't do that. We want to avoid those for at least 2 weeks as well. Wear your prescribed bite appliance every night. So depending on your case, you will probably have made some type of an appliance to keep you from grinding and clenching your teeth. This is important to keep your teeth from wiggling. Wiggling things don't heal. So we want your bite appliance in there to protect things from wiggling and shifting. So wear that every night, just like prescribed. No heavy physical activity for 3 days. We don't want you starting a new exercise regimen and get your heart rate up and blood pressure up, and that'd be pumping through this area. We need to let it rest. Ice over the area, 20 minutes on, 20 minutes off, 20 minutes on, 20 minutes off. Keep alternating that all day long for at least 2 hours minimum, but all day will help you heal and avoid a lot of swelling and discomfort. Don't be alarmed about swelling or bruising for the first week. No matter what, it will swell, it will bruise. You had oral surgery, so it's going to do this. But don't obsess over it for the first week. Do not eat anything crunchy or sticky food that can get stuck in between your teeth. Kind of thinking about like almonds and nuts and stuff. You don't want those rammed in between those teeth where we just did this delicate procedure. Expect cold sensitivity. Your gums, the reason we're here is because you didn't have gums covering your roots anyway. So don't be too alarmed that you're going to be more sensitive than before we started the procedure. It will take about 6 weeks for that sensitivity to diminish and go back to normal. Pain control, follow the enclosed combination therapy card. We think this works the best. It's with your home care kit today. Follow that to the letter and you will have optimal pain resolution for sure. Call us immediately if you have any unexpected pain, like if things are getting worse after the second day, if it continues to bleed after the second day, if you have any heat or increased swelling after the second day, definitely call us for sure. We want to help you with that. And you must return to our office after 2 weeks. There are exceptions to the rule, but that's when we'd like to see you after the surgery. And after the 6th week, you could brush the surgical area again with the special soft tip bristled brush. Don't ever use an electric brush in this area again. Those are your highlighted areas for your pinhole surgical technique. Congratulations on getting through it, and we hope you heal optimally. Call us if you need anything, 625-7969. Thank you.